Hello, and welcome to IMG 320, Advanced Patient Care and Medical Imaging. I'm going to be your instructor for this course, and my name is Tim Depinet. So here's my contact information. My email here is timothy.depinet@mercycollege.edu, and my cell phone is 419-306-0529. Feel free to contact me with either one of these. If you want, you can actually send me a text as well too. If I don't reply right away, don't panic. I'm just a little busy at the time, but I promise you I will get back to you as soon as possible. And also same with the email. Feel free to email me with any questions or concerns or comments, and I'll be happy to reply to those as well. As you can see, I am a certified nuclear medicine technologist, and I have been now for over 19 years. So right now I'm currently in nuclear cardiology, and I have been for the past 17 years. But I have done all facets of nuclear medicine, and obviously being in the field for over 19 years, you tend to know a little bit about patient care. So hopefully I can pass some of my knowledge on to you, and actually hopefully some of you guys can pass your knowledge on to me as well too. Obviously our number one job in any type of healthcare profession is patient care. So hopefully I can help you guys along that path, and you can help me as well too. Here's the textbook for the course. Hopefully by now you all have this, either on paperback version or an e-version. So the title is The Patient-Centered Care in Medical Imaging and Radiotherapy by Ram, Lau, and Vosper. It is a first edition, so it should be the only one out there like it. If you have any issues or questions or concerns about getting this book, please let me know, and we'll figure it out. Here's going to be the course layout. Our major topics that we're going to cover, Module 1 through 3, is going to talk about communication, psychosocial, and other aspects. Module 4 will be pharmacology and infection control. Modules 5 through 7 will be medical imaging procedures. And then finally, Module 8 will be performance and quality measures. So to talk about the first three modules, communication, psychosocial, and other aspects, we're going to talk a little bit about communicating with specific populations. Those populations that are cancer patients, elderly patients, pediatric patients. Pretty much on how to communicate, to deal with, to associate with those specific populations. We're also going to talk about communicating with disabled patients. Some of these patients may or may not need special accommodations. You could be blind patients, it could be a deaf patient, it could be those that are mentally challenged, whatever the case might be. This will kind of talk a little bit about communicating with with that patient population as well. Also, we're going to talk about cultural and social diversity. I know that, for instance, I had a patient one time that I introduced myself and my nurse to him, and I shook his hand, and my nurse went to extend her hand as well too, and he wouldn't shake her hand because he said in his culture he doesn't shake women's hands. So it was an eye-opener for me, but it was something that as a healthcare provider we have to understand and respect different cultures and try to treat them as if they didn't have any type of regulations or guidelines that they went by. Another one is patient emotional aspects. So we need to deal with talking, if a patient was just given a cancer diagnosis. You're going to get patients that are come in that are very upset with how their health is. In other words, they're mad at the world, and so we need to find a way to deal with them and to help communicate with them to get them through the procedure. Another part of it's going to be pharmacological as well in infection control. We're going to talk about drugs and contrast media. We're going to talk about the pathogens in medical imaging, MRSA, HIV, C. diff, TB, hepatitis. All these are very serious. Some patients come in with these pathogens. How are we going to protect ourselves? How are we going to help them? We can't treat them any differently, but we also need to be safe and be careful as well. Microorganisms responsible for disease in healthcare, bacteria such as staph and strep and listeria, and then viruses, the rhinovirus as well as the varicella. So we're going to talk a little bit about those as well. And then also the big important part of infection control is how to protect against these infections. Your gloves, your masks, your gowns, your scrubs, whatever the case may be. So we'll talk about those as well. Then we're going to talk about medical imaging procedures. Obviously, all of us here are in one of these, or maybe more than one too. Then we're going to talk about non-ionizing, the MRI and the ultrasound, and then we're going to get into the ionizing. which is pretty much, the CT, the nukes, the regular X-ray, the MAMs, and things like that. So we're going to discuss a little bit about each one of those. And then also we're going to talk about performance and quality measures. Now this is something that's big in every department. Every department for the most part is going to be accredited, be it ACR or in the nuclear world it's IAC. So we all have performance measures, quality control. We all have the type of things that are going to show us that make sure that we're doing things properly. We're going to talk about scanner quality control. I know in nuclear, every single day that we do scans on that camera, we have to do the quality control for it. We're going to talk about department performance, patient wait times, radiation doses, image quality. We want to make sure the wait times aren't very long. We want to make sure the radiation dose is as low as possible, but we also need to make sure our image quality is superior. And then also we want to talk about measures of care. And this is like patient satisfaction surveys and also patient perception outcomes. And like I said, all of these are going to be pretty much based along with your accreditation guidelines. Also in this course, we're going to have a discussion board. We're going to put questions or topics out there, and we're going to have you reply to the topic and then also reply to two of your peers' responses as well. Now, I look at these discussions very, very closely. I want you to get involved. I want you to use professional thinking, put some thought into it. Ask questions, to your peer and just say, hey, look, explain this a little bit more to me. But also, too, be sure to answer any questions that are directed to you. So now we do have a rubric for the discussions, and I'm going to hold you all to this. This is pretty important. The one thing that I really want you to notice, if you want to get an A, that pretty much the 9 or 10 points, you need to make sure these postings are evenly distributed throughout the discussion period. Now, what this means is the discussions are going to start, I believe it's Monday morning, first thing, and then you have until Sunday, I believe, to finish it all up. I don't want you to log on Sunday morning to put your main post and then reply to two others' posts within a couple of minute period. To me, that's down in the sea level here. This is where everything was posted on one day. So that's, to me, unacceptable. What we need is, do a posting, your main posting on one day. You can come back the next day, reply to a couple of peers. Make sure that if somebody asks you a question, you reply to that person. So if you wait until Sunday, it doesn't give anybody time to ask any questions. So that's just not being involved. So I just wanted to make sure that you guys are aware of this rubric. Look at it, check it out. If you have any questions, please let me know. But the discussion board is mainly for, it's for fun and for learning. I will be involved on it. I will reply to your your responses. I will read them all, I guarantee it. So be sure to put some thought and make it professional. And like I said, that way everyone can learn from it. The major course project is going to be, I need you to produce a medical imaging patient education tool. Now, this can be a couple of different things. Number one, it's an infographic, which is like Pictochart. Now, if you go to pictochart.com, it'll have a lot of templates and everything for you to do. You can make, in the next slide, I'll show you a good example of what one would look like. And then also, too, a trifold brochure if you'd like. There are free online software if you wanted to, templates and things like that online if you wanted to make a brochure. What this is going to do is this is going to be an education tool for your patients. I need you to keep it simple. You're looking at about a 5th grade level here. I want something that your patients need to know. So keep it, very simple. Make sure that the patients, it's going to be more or less a typical question that your patients are going to ask. They're going to say, how much radiation am I getting for the scan? Maybe you can talk a little bit about that. Am I going to glow in the dark? I'm sure many of you have heard that question before. Or just something like that. This is an educational tool, and it must educate your patients. Now, here are some examples. On the left side of the screen is what the Pictochart would look like. Obviously, very, very fancy. These are templates that are actually in pictochart.com. Feel free to go online and go that route. The one on the right is a little more simple, but yet still gets to the point.
It's a very good educational tool for people, especially in this case for teenagers. It shows pictures of what can happen to them if they continue to smoke, and also it shows a good way of how to quit. So these are just a couple of examples of what I'm looking for this final project. So that's it. I hope everybody has a great time with this course. If you have any questions, please, again, my contact information is on the slide, and it's pasted throughout the website, our course page on the website. Please let me know if you have any questions or concerns, and just have fun with this. Obviously, patient care is the #1 part of our job. We all know it. We all know it very, very well. So please feel free to share your experiences, share what works for you, because believe it or not, everybody's going to learn something from this course, and we think we know it all, but in reality, we really don't. So we'll take any advice that we can get. So have a great course. Again, have any questions, please contact me, and look forward to working with each and every one of you. Have a great day.